When it comes to breast cancer care, trust can literally save lives. But what happens when that trust is broken? I'm Dr. Frederick Lee II, emotional intelligence practitioner, executive coach, consultant, and speaker. In my dissertation research, one theme kept showing up again and again: trust, or the lack of it, between patients and providers. For many women, especially Black women, the question wasn't just, do I trust this treatment? But do I trust this system at all? History explains why. From medical experimentation on Black bodies without consent to ongoing disparities in care today, trust in healthcare hasn't always been earned. And in personal experiences, being dismissed, talked over, or minimized, and trust erodes even more. One woman told me, "I didn't feel like my doctor saw me as a person, just another number." Another woman shared, "When I spoke up about my pain, I was ignored until it was too late." Those stories aren't rare. They reflect systemic patterns of bias that fracture trust. But here's what my research also revealed. When women did trust their providers, the impact was transformative. They followed through on breast cancer treatment. They felt more confident in their choices and they reported less anxiety. Trust wasn't just emotional, it was practical. It improved outcomes. And trust isn't built by accident, it's built through listening, respect, and partnership. Providers who slowed down, explained options, and validated patients' concerns helped women feel seen and heard. Families and communities who played a role reinforcing that patients had the right to demand answers and clarity. The role of trust goes deeper than medicine. It's about dignity. It's about knowing that when you walk into an exam room, the person across from you values your life as much as you do. Until healthcare systems commit to building trust through equity and accountability, patients will continue to carry that burden themselves. But when trust is present, it makes the hardest journeys just a little lighter. Here's how you can build and strengthen trust in healthcare. Number one, as a patient, speak up. Ask for clear explanations and don't settle for vague answers. As a provider, listen deeply. Validate concerns, especially from those who've been historically marginalized. And finally, as a community, hold systems accountable. Advocate for policies that demand transparency, cultural competence, and fairness. Go into the comments. Share with us, what's one experience where you felt deeply heard or completely dismissed by a provider? Your story can remind us all why trust matters. I'm Dr. Frederick Lee II, and this has been your lesson in life.